Hello and welcome to this webinar on high-intensity focused ultrasound. I'm Dr. Mistry, a board-certified urologist here in Central Texas, and I'm here to talk to you about an innovative treatment for prostate cancer, one that is focused on preserving your quality of life and really a pioneering therapy for focal therapy for prostate cancer. A little bit about myself. I trained at Baylor College of Medicine in Houston, Texas, a real center for prostate cancer research and innovation. I have been studying prostate cancer for over 20 years, and in clinical practice, I have treated tens of thousands of men with prostate cancer and hundreds of men with high-intensity focused ultrasound. For those of you that want to get a little more of me, I host a podcast that is weekly broadcast on all of your podcasting platforms, the Armor Men's Health Show. And for those of you in Central Texas, you can hear us on the radio on News Radio KLBJ. Prostate cancer remains the most common solid cancer amongst men in the United States. It is diagnosed over 250,000 times a year, and although it is not the most common cause of death, it is the second most common cause of solid tumor death in the United States, right behind lung cancer. So although there's a narrative that prostate cancer affects a lot of men but doesn't kill a lot of men, that isn't completely true. Although we are fortunate that most men will die with their prostate cancer and not because of their prostate cancer, it is a leading cause of death in the United States. Most prostate cancer is diagnosed after a blood test is performed that finds a risk for prostate cancer. The most common test is a prostate-specific antigen, commonly known as the PSA. The PSA test is done in men usually over the age of 45. If you're African American or have a prior history of cancer in your family, we might do it earlier. And generally speaking, we stop testing people in their late 70s or if their medical conditions limit their life expectancy. The PSA is a protein that's produced by the prostate. It can be elevated in cases of prostate cancer, in cases of prostate inflammation, as well as for enlarged prostate issues. The blood test is done usually annually, and there are special variations on the PSA test that can be offered by your provider, including the 4K test that might give us additional insight into prostate cancer risk. If you are found to have an elevated prostate-specific antigen, or PSA, we might do additional tests. The first one that we do in our practice is a prostate MRI. We use this test to better understand the anatomy of the prostate and to decide if a special kind of MRI-guided biopsy is necessary. Many of you listening to this webinar may have already had a prostate biopsy and a prostate MRI in the past. And if you haven't, if you become our patient, oftentimes we will order one prior to proceeding with this type of treatment, high-intensity focused ultrasound, or any other form of treatment. If you've had a prostate biopsy, then you know that that pathology is reviewed by a pathologist, and those images give us some insight into the aggressiveness of the disease, where it is, and how much you have. Additional testing can be done on that tissue. We call that genomic testing. Many of you may have had something called the GPS test or the Decipher test that gives us additional information on how aggressive that disease is. After you are diagnosed with cancer, in our clinical practice, which may be different than what you get in your own clinical practice or experience, we will do staging tests. I want to make sure that that cancer hasn't spread anywhere. And the tests that we use most commonly include a bone scan and a CAT scan of your abdomen and pelvis. In this case, we are looking for spread of disease to bones, and we're looking for any involvement of lymph nodes. A newer test that's allowed or available is called the PSMA PET scan. This PSMA PET scan is not available everywhere, but it is covered by most government carriers. Most commercial carriers will also cover the procedure if you have advanced prostate cancer risk factors, such as a PSA over 20 or a Gleason's 8 prostate cancer. This is the most advanced form of imaging that we have to look for cancer that may have spread outside of the prostate. If you've been diagnosed with prostate cancer, and your doctor thinks that it is still localized to the prostate gland, meaning that it has not spread to the bones or the lymph nodes, you have undoubtedly been given your treatment options. None of these options are great. It would be nice to not be diagnosed with prostate cancer in the first place. Weighing the risks and benefits of each treatment is critical in finding that option that is right for you. Watchful waiting or active surveillance involves getting regular PSA measurements, not acting upon any immediate treatment option that is more invasive, and can sometimes result in additional biopsies and more PSA testing. Although this form of treatment or form of management can avoid the side effects of more invasive treatments, it can result in a delay of treatment, perhaps eliminating radical prostatectomy and radiation therapy as options, and can cause anxiety that can lead to a diminished quality of life. The robotic radical prostatectomy has been around for over 20 years, and although we've been removing prostates for much longer than that, the robotic prostatectomy still offers some of the best treatment outcomes when it comes to your cancer. Unfortunately, that's at a cost. Removing the prostate gland, which is an organ that you can live without if you don't plan on having any more children, can result in injury and impact on your erections and can lead to urinary incontinence. Radiation therapy is also a mainstay of treatment for prostate cancer. There are multiple forms of radiation therapy, which can include X-rays that are delivered externally, as well as radiation that's delivered internally through seeds or rods. Side effects of radiation can be seen immediately, but really in our practice, we emphasize how many side effects can be seen really late, including 20 years later. These can include the risk of secondary cancers, impotence, and in some degrees, urgency incontinence and damage to the bladder. Radical surgery versus organ-sparing treatments are not new to the prostate gland. Breast cancer is a great model for how evolving concepts in prostate cancer treatment are developing. When it comes to breast cancer, we often don't remove the entire breast. We try to focus on where the tumors are, but we have to have great imaging and great information about the pathology. This is the same for prostate cancer. And innovations in imaging techniques with MRI and PSMA PET scanning, as well as improvements in how we can look at pathology, are making organ-sparing treatments for prostate cancer a reality. When it comes to organ-sparing therapies for prostate cancer, we classify them as focal therapy, and there's more than one. Today, I'm going to be talking about high-intensity focused ultrasound, perhaps the most well-studied and most widely used form of focal therapy. But there are others. Cryotherapy, irreversible electroporation, and laser ablation are all going to be options that you see for focal therapy available on the internet and perhaps from your physician. Each of them has their positives and negatives, and we perform mostly high-intensity focused ultrasound in our practice, mainly because it is non-invasive and has the most clinical evidence. The rationale for focal therapy or organ-sparing therapy for prostate cancer has to do with concerns about over-treatment. Over-treatment is why many men do not get any treatment at all. The prospect of causing incontinence and impotence from treating prostate cancer that wouldn't have affected a person's life is something that disheartens many urologists and the scientific community. So how do we balance taking care of men and saving men from dying of prostate cancer or causing a decrease in their quality of life without any benefit? Focal therapy is the answer. We have in the United States, in a previous slide mentioned, over 250,000 cases of cancer with 35,000 deaths. How do we prevent 250,000 men getting overtreated for prostate cancer? What is high-intensity focused ultrasound? Ultrasound is a technology that we are very familiar with in the medical profession. In urology, we use ultrasound to image the prostate gland and often image the kidney. If we take those sound waves, which is what ultrasound technology is, we can use those sound waves to look at internal organs. But if we turn up the intensity of those sound waves, kind of like using a magnifying glass to intensify rays of light from the sun, we can actually cause tissue damage in a focused and desirable way. In urology, we use it for breaking up kidney stones. Extracorporeal shockwave lithotripsy uses ultrasound or sound waves to vibrate and break up stones. And if you turn up that energy even more, 5,000 times more than the energy used for looking inside the body through imaging, we can cause heat effects that causes tissue damage. And we are using this property of sound waves to treat prostate cancer in a focal way. High-intensity focused ultrasound, or HIFU therapy for prostate cancer, is a non-invasive procedure, which means there are no incisions. There's no radiation. It causes heat through the use of sound waves. This treatment utilizes imaging to minimize the impact on critical neighboring structures, such as the sphincter, which controls your urinary continence, and the nerves that help you keep your erection. Unlike treatments such as surgery or radiation that affect the whole gland and can damage surrounding tissue and structures, the purpose of focal therapy is to precisely target where in the prostate we want to treat and to avoid damage to surrounding structures. High-intensity focused ultrasound is not new. It is being used by leading urologists around the world, and there are more than 4,000 procedures that are performed per year. HIFU has been well studied. There have been over 100 publications on the effectiveness of high-intensity focused ultrasound for prostate cancer, and we'll be going over some of those results at the end of our presentation today. The advantages of HIFU include that it's non-invasive, which means that there's no incisions. It can maintain your quality of life, having you back to work quickly and back to your regular activities shortly after the procedure. It's an outpatient procedure, which means that you go home the same day. And if done properly with proper planning, there's a low risk of side effects such as incontinence and erectile dysfunction. Using the sound waves to kill prostate cancer during a HIFU treatment is done in 3 different ways. There's a thermal effect, where the sound waves themselves increase the temperature of the tissue, killing the cells. There's a mechanical effect, where boiling off the water adjacent to the cancer will also kill the prostate. These are immediate effects. There's a late-term effect as well, however. This is the tissue effect. By killing the prostate tissue, we induce fibrosis, or an inflammatory response that continues killing the cancer weeks after the initial treatment. The principles of high-intensity focused ultrasound include a transrectal approach, a treatment that's non-invasive, and that it's contact-free destruction of a targeted area, which means that we are several centimeters from the prostate when we induce treatment. There's 3D imaging, treatment planning, and then the robotic therapy, all of which I'll be illustrating shortly. One of the greatest tools that allow focal therapy to be effective is the use of MRI guidance. In today's technology, using the MRI to find and target disease has been one of the greatest advancements that have allowed us to find and treat localized prostate cancer. Being able to integrate MRI fusion therapy with the focal therapy that high-intensity focused ultrasound allows has allowed us to treat cancer focally and to minimize side effects. What I have for you today is a short video explaining what you can expect on your HIFU day. This is the FocalOne platform that is the most technologically advanced form of HIFU. This is the robotically controlled arm that is inserted into the rectum and directs the energy. You'll be placed on your side after you're put to sleep, and the probe is inserted into the rectum. We will then create a 3D image and a 3D reconstruction using the ultrasound of your prostate gland. Here you can see how the 3D images can be manipulated, and then we import your MRI findings, and oftentimes, if you have had a special MRI-guided biopsy, we can even import where the biopsy cores were taken. We then will overlay these images with your ultrasound reconstruction. Using this technology, we're then able to localize exactly where your disease is based upon your MRI findings and plan treatment accordingly. You can see here, we're drawing an area of interest. The computers are creating a model, and we're able to direct the energy to kill that area of the prostate, which includes your cancer, with a safe margin of safety to kill any small cancer cells that were not seen on the MRI. This entire process is controlled robotically, and that's why you have to go to sleep so you don't move on the table. High-intensity focused ultrasound is only a tool. The guidance and knowledge of your physician is what you need to make sure that HIFU is the right technology for you and to make sure that your treatment strategy fits your cancer needs. We can use high-intensity focused ultrasound to just kill where the cancer is. This is most useful if you only have cancer where an MRI is positive or where you only have a small area of cancer in your prostate gland. If you have a larger area, we may use a different treatment strategy, including treating half of the prostate or even in some cases, treating the entire prostate. A unique place that HIFU has in prostate cancer treatment is in salvage therapy. These are for patients that have had a different form of therapy, usually radiation therapy, and the cancer after returning is still determined to be localized to the prostate, and we can use high-intensity focused ultrasound to salvage many of these patients and kill their cancer. When it comes to any form of treatment, especially cancer treatment, safety, safety, safety has to remain one of our most important priorities. The FocalOne system and most HIFU systems have multiple safety mechanisms to allow decreased risk of injury to surrounding structures. This includes a rectal cooling system, a system to make sure that you're not moving on the table, and important considerations in regards to your rectal wall and positioning to avoid damage to the rectum. Now, it's not all roses. There are some risks to high-intensity focused ultrasound, just like all forms of treatment. The tissue necrosis that occurs or the tissue death can lead to persistent bleeding or debris in a small number of patients. If you treat the urethra, which is the tube from which you urinate, you could cause a stricture or a narrowing of that tube, especially if you're treating the entire prostate. In some cases, especially after radiation, you could cause a devastating complication called a rectourethral fistula. It can lead to short-term urgency and frequency, some blood in the urine, and if done for the whole gland, it can lead to some degree of incontinence and impotence. This is where the use of high-intensity focused ultrasound for focal therapy really shines. A decreased risk of damage to surrounding structures is a highlight of this technology and our personal experience in our practice. Who is right for HIFU? Well, although many patients travel to our practice from all over the country for high-intensity focused ultrasound, we don't think that it's the right treatment for everyone. We would like to see patients with what we call low to intermediate grade cancers. This can include Gleason 6 and 7 patients. We would like to see a PSA under 20 and no evidence that the prostate cancer has left beyond the prostate gland. There are other special considerations as well. If you are young and have a fairly aggressive cancer, I might recommend that you have a radical prostatectomy. This is not to deny a form of treatment to you, but instead trying to give you advice on what we think the best form of treatment for you to live a long, healthy life. There are patient and cancer considerations that also need to be made. What is the patient's size and the patient weight? Are they going to be able to accommodate the probe that is inserted rectally because of different medical conditions such as prior surgery or hemorrhoid surgery in the area? Do you have an allergy to latex? How big is your prostate? The technology cannot work on prostates that are too big. And where is your lesion location? It's important to know what to expect after your HIFU treatment. All patients go home with a Foley catheter or a temporary urinary catheter that's inserted into the urethra into the bladder. In some centers, the catheter is placed through your abdomen, but in our center, we place it through the urethra in your penis. The catheter will be removed either after 1 week or 2 weeks, depending on factors related to your prostate size. Once the catheter is removed, you'll return to your normal activities and physical fitness routines. If you are coming from outside of our treatment area, your follow-up can be done by your local treating urologist, or we are happy to do all of our follow-up remotely. Now comes the real part, the data. If you compare high-intensity focused ultrasound with radical prostatectomy or with radiation therapy, what you'll find is that the more aggressive forms of therapy often result in better long-term cancer cure. But for a disease that does not kill the vast majority of patients that it affects, complete cancer cure is not always the goal. Cancer control, along with maintaining your quality of life, can be an important goal for many patients, and it is achieving this goal that we strive to do. When you compare patients that have had high-intensity focused ultrasounds with radical prostatectomy, you'll find that many patients that have had HIFU are often older. Although they have the same type of PSA and oftentimes the same kind of disease process, their rates of incontinence and erectile dysfunction are often much lower, and the treatment rates, the retreatment rates for recurrent cancer are equivalent. When your physician is giving you advice on how to treat your localized prostate cancer, it's a balance between cancer control and maintaining your quality of life. High-intensity focused ultrasound, when properly used in the appropriate patient, can lead to great cancer control and a wonderful maintenance of your quality of life. Oftentimes, patients will be concerned that this form of treatment is not covered by their insurance or may be too costly. In our practice, we take most all government payers and commercial insurances. Almost all government payers, such as Medicare and TRICARE, will pay for high-intensity focused ultrasound, and many commercial payers will as well. If you've had radiation therapy and need salvage therapy, almost all commercial payers, along with government payers, will pay for high-intensity focused ultrasound. But don't despair. Our cost out of pocket is very reasonable, and we have multiple vendors that will help work with you to make this procedure affordable. Facing the decision on how to treat your prostate cancer can be confusing, and this time can be tumultuous for you and your family. We would love to serve as a guide to help you navigate these different treatment options and understand whether high-intensity focused ultrasound is right for you. If you'd like us to serve as a second opinion, the information that we'll need includes your pathology reports and any molecular studies, MRI reports and any other imaging or staging tests, as well as your medical history. We would love to schedule this appointment for you. You can call us on our main number at 512-238-0762, hit our Contact Us button at our website, northaustinurology.com, or email me directly at drmistry, that's dr.mistry@naurology.com. Thank you so much for your attention. It is my pleasure to be able to give you this information and help guide you through this very important and difficult treatment time.